This is my head to toe, sorry, this is my 360. So this is my head to toe assessment, and my name is Macey Gold. So first things first, I walk into the room, I sanitize my hands, I clean my stethoscope with an antibacterial wipe, then I don my gloves. So then I walk into the patient room. Hi, my name is Macey Gold. I'll be doing your head to toe assessment today, and I'll be your nurse. Is that fine?
Yeah.
Alright, so can you give me your name and date of birth?
Kershid Malik, 2005, January 13.
Alright, so his ID matches up, and I have his consent to do a head to toe assessment. So then I close the privacy curtain and then go into my general survey. So for general survey, so first for appearance, he's normal for his age. He doesn't look too old or too young, and his skin color is distributed equally, and there's no kind of discoloration. So then I move on to body. So he has good posture, his body's symmetrical, and there's no visible deformities. So I move on to behavior. So he's making eye contact. He's not making any abnormal facial expressions. His mood and dress and hygiene are all appropriate for the assessment. So then I go on to mobility. Could you just take a few steps, please? So his mobility is normal. He's not favoring one side, and he's not stumbling or swaying or limping. So then we go on to work of breathing. So there's no signs of respiratory distress, and there's no shortness of breath or anything. And then for LOC, what's the date today?
4th?
The 5th, yes.
Of April.
Yes. What's the year?
2022.
What's your name?
Kershid Malik.
So he's aware of the time and date, he's aware of where he is, he's aware of his name, and he's like conscious and everything like that. So then we move on to face. So can you kind of just face me a bit, please? Alright, so first we inspect the head for any kind of deformities like that. We look for any kind of lesions, lumps, bumps, bruises, masses. There's none, so then I palpate. And I'm palpating for any kind of tenderness, which there's none.
No.
Or any kind of deformities, which there wasn't. So then I move on to the hair. The hair is equal in color. There's no dullness, and the texture is right. And then I palpate it, and there's no infestations or dullness. So I move on to the face. I inspect the face. The face is symmetrical. The color distribution is equal. There's no lesions. There's no masses. So I palpate it. Is there any kind of tenderness?
No.
And I didn't feel any masses or anything like that either. So then I move on to cranial nerve number 7, which is the facial nerve. So can you just raise your eyebrows? Can you puff out your cheeks? Can you smile? Close your eyes and try to open them. So he can move against resistance. So cranial nerve 7, which is the facial nerve, is intact. So I move on to eyes. So first the eyelash distribution is equal. The eyebrow distribution is equal. There's no infestations. For the lids, there's no lid lag, there's no ptosis. For the sclera is white. The conjunctiva is pink, and there's no discharge or swelling no discharge, edema, or crusting. So I move on to cranial nerve number 3, ocular motor. So first looking at his eyes, the pupils are round. They're equal in size. Specifically, they are 4 millimeters and 4 millimeters, so they're equal, they're round, and then, so are they reactive to light? So I'm going to do direct and consensual response. So direct, consensual, so they're reactive to light, and then we're going to look at whether they're accommodating or not. So you can just focus on the pen, please. And so his pupils dilated, then his eyes converged, and his pupils constricted. So cranial nerve 3 ocular motor is intact. So we move on to ears. So first I inspect ears. They're symmetrical. There's no discharge or crusting. So I palpate them. Any kind of tenderness. I palpate the auricles, palpate the tragus, any tenderness. So then I move on to cranial nerve 8 acoustic. So I do the whisper test. Can you plug one of your ears? So I'm just going to whisper 3 2-syllable words.
Monday, Tuesday, Wednesday.
So then I go to the other side. Thursday, Friday, Saturday. So cranial nerve 8, the acoustic nerve, is intact. So now I'm going to move on to nose and sinuses. So can you kind of just face me, please? So first I inspect the nose. The nose is midline. there's no abnormal flaring, and there's no discharge or crusting. So I'm going to palpate the sinuses, which is the maxillary sinus and frontal sinus. So any tenderness?
No.
Any tenderness?
No.
So then the nose and sinuses are fine. So then I move on to mouth and pharynx. So first I inspect the lips. The lips are pink, they're symmetrical, there's no lesions and there's no edema. Then I do the gums. Can you just do this? So the gums are pink, there's no bleeding and there's no lesions or edema. And then I do the teeth. So the teeth are symmetrical, there's the right amount of teeth and there's no breaking or missing teeth. So then I do the hard and soft palate. So the hard and soft palate are intact, which is good. And then I check cranial nerve number 9 and 10, which is glossopharyngeal and vagus. So can you just stick out your tongue and say ah?
Ah.
So the uvula and soft palate rise, which means 9 and 10, glossopharyngeal and vagus are intact. So now I move on to cranial nerve number 12, which is the hypoglossal nerve. So can you stick out your tongue and move it side to side? Yep. And then can you move your tongue inside your cheeks? And you can do it against resistance. So cranial nerve 12, hypoglossal is intact. So I move on to neck. So neck, so first I inspect, there's no signs of hyperthyroidism, there's no edema, there's no masses, there's no lesions, lumps, bumps, bruises, and there's no moisture, so now I palpate. Do you feel any tenderness?
No.
So he didn't feel any tenderness, and I didn't feel any masses or lesions or anything. So then I move on to the carotid arteries. So I just feel one at a time. So the rate was 82, the grade was 2+, and the rhythm was equal, and I do the other side. So the rate was 82, the grade was 2+, and the rhythm was equal. So now I move on to cranial nerve 11, which is spinal accessory. Can you just raise your shoulders against resistance? Yep. And then move your head against my hand. So cranial nerve 11, spinal accessory is intact. So now I move on to arms and legs. So first I inspect the arms for symmetry. Can you just roll up your sleeves past your elbows? Thank you. So first he just lays out his arms. The arms are symmetrical. There's no involuntary movements. There's no edema. There are lesions, so I would document that. So then I palpate the brachial pulse. So the pulse is 82, the grade is 2+, and the rhythm is equal. And then I palpate the arms. Did you feel any tenderness?
No.
Okay, so there's no tenderness. So then I palpate the radial pulse. So the rate is 82, the grade is 2+, and the rhythm is equal. So now you can just turn off your hands. So then I check capillary refill, which is less than 2 seconds, which is good. So then I move on to legs, and there was no any kind of moisture or anything on the skin. So then I inspect the legs. The legs are symmetrical. There's no involuntary movements. There's the hair distribution is equal. There's no lesions, lumps, bumps, bruises, or masses. So now I palpate. Do you feel any kind of tenderness?
No.
And the temperature was equal on the legs. So I check the dorsalis pedis pulse. The rate was 82, the grade was 2+, and the rhythm was equal. And then I check the anterior tibialis pulse. So the grade was 2+, the rate was 82, and the rhythm was equal. So I do capillary refill for the toes. So the capillary refill was less than 2 seconds, so that's normal. And then I would sanitize my hands. So now I move on to thorax. So first I'm going to do the breath sounds, so bronchiovesicular, vesicular, and bronchial. So vesicular sounds first. Bronchio sounds first. So that's in the next, and I check with my diaphragm. So can you just breathe in and out every time I move my stethoscope? Yeah. So there are no abnormal sounds, so then I do bronchiovesicular, which is the sternal borders. And then I do bronchial sounds. So there were no abnormal breath sounds. And I also inspect, so then I inspect the thorax for any kind of So I inspect for moisture, I inspect for edema, masses, and lesions, lumps, bumps, bruises, which there's not, and then I, okay, can you turn around please and face the window? So then what I do is I palpate, so I palpate for any kind of tenderness, lumps, bumps, bruises, lesions, or masses, and temperature and moisture. So there's no moisture, the temperature is equal. Did you feel any kind of tenderness?
Nope.
Alright, so I do APT ratio. So it's 1 to 2, which is normal. So his APT ratio is good. So now I listen to, so then I'm going to percuss. So I'm going to be percussing for dullness and resonance. I expect to hear dullness over the bones and liver and resonance in the intercostal spaces. So I've percussed and I didn't hear any abnormal dullness or resonance. So now I'm going to listen for the full cycle and I'm going to find the rate, respiratory, the rhythm, and look for any signs of tenderness or anything like that. So can you just breathe in and out every time I move my stethoscope? And I'm using the diaphragm. So the rate was 16 breaths per minute. The rhythm was equal. There was no wheezing. There was no kind of rubs or bruies. And the breathing was equal bilateral. So now I'm going to do tactile for minus. Every time I move my hands, can you just say 99, please?
Yep. 99, 99, 99, 99. So
the vibrations were equal bilaterally, and there was no favoring of one side. So then can you turn back around, please? So I'm going to do cardiovascular. So first I'm going to palpate and auscultate the landmarks with my diaphragm. So first I'm going to find the aortic valve. So that's second intercostal space on the right sternal border. And yeah. I'm going to listen. So then I'm going to go to the pulmonic valve, which is second intercostal space, left sternal border. So I'm going to go to the Erb's point, which is third intercostal space, left sternal border. And then the tricuspid valve, which is fourth intercostal space, left sternal border. And then I'm going to go fifth intercostal space, fifth intercostal space, left midclavicular line. So then there were no abnormal sounds. So then what I'm going to do is I'm going to so now I'm going to describe where I'd find S1 and S2 sounds. So I'd find S1 sounds at the apex of the heart, which is the I'd sanitize my hands after blowing my nose and don new gloves. So the S1 sounds are found at the apex of the heart, which is the left midclavicular line, fifth intercostal space, at the mitral valve, and then S2 sounds are best heard at the pulmonic valve, which is second intercostal space, left sternal border. So now I'm going to auscultate for any abnormal sounds. So those will be S3 and S4 sounds, and murmurs and rubs, which would be found at the mitral valve, which is fifth intercostal space, left midclavicular line, and I'm going to listen with my bell of my stethoscope. And I'll also listen for S1 and S2 sounds at this point. So there were no abnormal sounds heard, so I listened for S1, S3, S4, and murmurs and rubs. And then I listened to the pulmonic valve, where S2 is found. And there were no abnormal sounds heard. So cardiovascular is good. And I palpate the apical pulse, which is right sternal border, second intercostal space. So I was able to feel it. And yeah, so then I'm done cardiovascular. So now I do abdomen. Can you lie on the bed, please? So first what I'm going to do is I'm going to inspect. So, can you just put thank you. So his abdomen is flat, the contour is normal, it's equal. There's no favoring of one side, the hair distribution is equal. So what I'm going to do is I'm going to auscultate. I'm going to auscultate for bowel sounds. I'm going to keep my stethoscope at each quadrant until I hear a bowel sound. And I start in the right lower quadrant. So there were bowel sounds heard in each quadrant, and they were loud and gurgling, and the rate should be about 5 to 30 each minute. So then I'm going to percuss. So I'm going to be listening for general tympany, and I'd start in the right lower quadrant. So I heard general tympany, and there was no abnormal sounds. So I'm going to be palpating. So I'm just going to be checking for any kind of tenderness or guarding or rigidity. So I start in the right lower quadrant. Do you feel any tenderness?
No.
Do you feel any tenderness?
Oh.
Do you feel any tenderness?
Oh.
Do you feel any tenderness?
Oh.
Right, you can get up and sit back. So now I'm going to do musculoskeletal, and I'm going to be checking the range of motion as well as looking for tenderness or altered range of motion. So first, can we do fingers? So you're going to flex, extend, and then we're going to wrist, flex, extend, radial deviation, ulnar deviation. We're going to do elbows, so flex, extend, pronation, supination, and then we're going to do shoulders, so adduction, abduction, internal rotation, external rotation, and then we're going to do feet, so it's going to be plantar deviation, dorsiflexion, so can you raise your feet towards your body, and then plantar flexion, so away from your body, and then against resistance, so dorsiflexion and plantar flexion, and that's my head to toe.